Good afternoon, everyone. Thank you so much for joining us on another Frontline conversation from Leadership Greater Washington, this time with Marla Dean, the Executive Director of Bright Beginnings. And before I introduce Marla, I want to thank PNC Bank. They are now the sponsor for the Frontline Conversations. They have for years been the sponsor of our Lessons in Leadership. And since we can't meet in person, they decided now to sponsor Frontline Conversations. So we have Terry Copeland from PNC here to welcome you all. And Terry, thank you so much for your sponsorship and your continuing support for LGW.
Thanks, Doug. You know, it's always a privilege to be associated with such an organization as Leadership Greater Washington. PNC is proud to be the sponsor for Frontline Conversations, as you said, now that we've transitioned from Lessons in Leadership. But we're also proud that Leadership Greater Washington was the presenters for the Racial Equity Series at PNC, as we hosted that as well in conjunction with another organization. So it's just to establish that long-term engaged partnership that we value with Leadership Greater Washington. I am really privileged also as a board member of Leadership Greater Washington to be asked to introduce Dr. Dean, because she and I have a great relationship. I'm also a board member of Bright Beginnings Incorporated. And so that it's a privilege to be able to introduce Dr. Dean. We've worked together now for several years since she's been the executive director. She is very passionate about early childhood education. She is an advocate for policy, procedures, laws that engage with families that are in transitional housing. The populations that Bright Beginnings serves has the greatest need probably of any population in need of early childhood education. And Bright Beginnings, because it is transitional families in transitional housing and or homeless families, which is a very unique population. So I'm thrilled to not only represent LGW, but to represent Bright Beginnings as a board member and introducing Dr. Dean.
Terry, thank you so much. And you just got a shout out from Stephanie Shane, class of 2015.
Hi, Stephanie. Thank you.
So Marla, how are you? How are you feeling? How's your health?
Well, hi, Doug. Before we talk about me, I just want to thank LGW and PNC and Terry, who's on our board. She's wonderful. And the whole LGW team, Debbie, Chase, Nanny, Emerald, J, all of you. I'm just finishing my first year, so you guys have had such a tremendous impact on me over the last year. So I just want to say thank you for this opportunity.
And you know, we claim some credit for Bright Beginnings. The class of '89, our third class. Marty Kendrick Kettner is on the chat today, on the conversation today, who helped get you all started. So Junior League of Washington and LGW so team together to help Bright Beginnings get started a long time ago.
Exactly, and we're actually celebrating our 30th anniversary this year. So you guys were instrumental then. The Junior League of Washington is the founding organization. And so we thank you for your continued commitment to Bright Beginnings.
So how are you feeling? How's your health? How's life treating you? How are you dealing with all the stress and the struggle that we're all going through now?
So I'm feeling concerned yet hopeful. And what I mean by concern, there's just a lot going on in the world, and this is an unprecedented time, but yet I'm very hopeful. I'm a person of faith, and I don't believe that all of these different issues would converge at one time if it isn't for us to become better after this storm. So I'm looking forward to the light at the end of the tunnel. I know the tunnel has been difficult, but I'm excited about the light at the end of this process.
So my mantra has now become 2021 is going to be a great year.
Yeah.
I have this firm conviction, firm belief that 2021 is going to be a great year. We just got to get through the next 5 months and get out of 2020 to get to 2021. So when COVID hit, what was that like for you? What did you do with your organization and how did you respond? It looks like you are at your facility now.
We are open.
How's your work situation?
Well, when COVID hit, we were trying to stay open as long as it was humanly possible. But then at a certain point, we had to make the decision in the best interest of our staff and our families that we needed to close and really understand what we were facing. At that point in March, we were, my team and I were doing 12 to 14-hour days. We were exhausted emotionally, physically, but we were really concerned about our families. And if we close, what would that mean for them? Bright Beginnings has a 3-part mission, and the first is ensuring children are kindergarten ready. So that's important. We were concerned about our children. The second was that they're in a safe, nurturing environment. And because our families are experiencing homelessness, we were concerned about what that would mean to them. And then finally, we are committed to our families moving from crisis to self-sufficiency. So it was a hard decision to close. And after we figured out how to close and still serve, we built a platform, a home learning platform. We immediately started having both distribution and delivery days where we delivered all kinds of resources, items, learning items for children, but also clothing, food, anything that our families might have need, because not only are we an ECE center, we also provide wraparound services. And so we wanted to make sure that the child was safe, but the families were also able to manage this really intense, high stress environment.
So I don't mean to make you nervous, but that's an enormous responsibility, looking after these children, looking after their families. Many of them are homeless. How do you sleep at night? How do you get through the day worrying about these kids? You know, that's an incredible responsibility, Marla.
Well, sleeping is, I'm sleeping more hours now than I did initially when it happened. I was definitely up early in the morning, late at night, really thinking about how do we support in these times where it's just something no one expected. And so we figured that out, and I sleep because I know that I have a great team. I know that we're doing everything we can. We're doing a yeoman's effort to meet the needs of our families. After we got our at-home learning platform up and running, we were able to distribute devices, tablets to our families so that they could have access to learning and continue that. And the innovation was just remarkable. On behalf of my team, we started Project Brighter together to ensure that their needs were, the families and the children's needs were being met. And so after a while, you begin to calm down because you're starting to feel like, okay, we're still supporting our families. But in those initial days, there wasn't much sleep, honestly. There just wasn't. Very concerned about our families.
And how did the children react? Were they anxious, nervous, concerned? What was their response?
Children, what we know from our parents, because our family advocates kept weekly contact with our families to know, we had to produce videos to let the children know what was going on, that we were walking on, we couldn't wait till we saw them again. And so, yes, there was some impact on our children. We're a consistent factor in their life. And this created a degree of inconsistency and uncertainty. So when some of our children started to return, when we opened July 6th, you could see the joy on their faces. I think they were a little tired of spending so much time with their parents. And so they were quite eager to see their teachers. But our teachers kept in contact with them. We continued to provide lessons. So they saw their teachers' faces and those types of things, which really helped to provide some normalcy in a really not normal situation.
So you reopened July 6th and you're still open today. That leads to a whole new set of questions. How do you socially distance yourselves in that environment? You can't. And is the PPE scaring the children? I mean, how does that work? How are you providing services today to the students? And all the students back, or do you alternate them?
No, so all the students are not back. So we went from a completely brick and mortar model to a totally online model. And now we're operating under a dual model, both brick and mortar and virtually. Some parents were willing to or felt comfortable to bring their children back, and we're servicing those students, and some are not. So they're still getting our services virtually. And so now we have to provide both at the same time. We spend a lot of money on PPE. We spend a lot of money on cleaning. We converted to something called electrostatic cleaning that I had never heard of. We bought all kind of sanitizers, toy sanitizers, every kind of sanitizer there is. I mean, to open, it's cost us about $55,000 to just reopen. And a lot of those costs are going to be ongoing. Of course, we had to buy masks and face shields and smocks and all kinds of things. So we had to talk to our parents. We sent videos before they opened. We talked to our children. This is what it's going to look like. This is what you're going to see when you return. And we did a lot of kid-friendly videos so that it's not scary.
You mentioned $55,000 in extra costs just for the PPE and just getting ready to reopen. How's your budget right now? And I know you're dependent on government funding, and you've been a vocal leader in the region for childcare, for continued funding of that. And it really is, people say that nobody's going to go back unless they feel safe, but also they're not going to go back unless they feel safe sending their children to childcare or back to school as well. So you are an important part of the recovery.
Well, we are essential to the recovery.
Yes.
Not only do we provide child care to the children, to the families, and I mean the industry at whole, in total, not just Bright Beginnings, but to children, in our case, the most vulnerable children, but we provide child care for the teachers who are going to go back into our K-12 system. So, and it's going to allow parents to go back to work over time. So we are truly essential to DC reopening, to the DMV reopening, and being able to recover economically from this situation. So yes, it's been expensive, and our budget right now, we're doing well. Our partners, our donors have assisted us, but we're concerned about FY21 starting October 1. We know that the costs will mount. We know that we spent $55,000 recently. We expect that we'll spend about $250,000 over the course of the year to ensure that our children are safe, that our staff is safe, that our parents feel comfortable, and that we're making sure that we're not susceptible to being impacted by COVID. We know that we believe that NACE, the National Association of Education of Young Children, believe that at the end of this pandemic, DC may have lost 6,596 licensed child care slots. So we need government support. We're concerned about reduced numbers, increased costs, the staffing ratios. So there's a lot of complications to this effort, but we're just trying to get the message out that we are an essential part of the recovery, and child care centers like Bright Beginnings and others are going to need the advocacy and support of the community to come back online. And I did an op-ed for the Washington Business Journal on this issue, because a lot of child care centers are very concerned that they may have to close.
And if that happens, then our recovery, our coming back to a better situation can't happen. I mean, it's really a drastic situation. How is the DC government responding to your comments?
The DC government, I think, has been a strong partner. They maintain the subsidy funding, even though we were not in a brick and mortar situation. Over 770 child care facilities in DC receive child care subsidy payments from the DC government. So it's a big source of revenue for child care centers. And for DC to make that commitment through the fiscal year, we're really excited about that. But this is going to be not just a local issue, but a national one that's going to assist all child care centers in being able to stay online and serve our families and our children.
And DC's budget is not looking good for the next fiscal year. None of the government's budgets are looking good. It's a real challenge for them. So,
it is.
give us
but yet, DC thus far continues to demonstrate a commitment to trying to figure it out. And I think they've chosen people's personal health and tried to balance that with the economic impact of all of this on everyone.
So give us, what's a normal day at Bright Beginnings now? How does it work? With the children coming to the facility, how do you do any kind of social distancing? Give us an example of what a day's like.
Well, right now I'm in violation of policy. As soon as you come into the building, before you enter the building, you must have on a face mask, and I am in the building without a face mask, so don't tell anyone. And then in addition to that, every classroom is assigned a time to bring their child to Bright Beginnings. We're fortunate. Each classroom at Bright Beginnings has a door to the outside. So the family brings the child to the door of their classroom. Each family is assigned a 5-minute window where they have to do a series of health checks, COVID checks, to make sure that there's no symptoms and that the child is well. Before entering, our teachers get here early. They're making sure, even though the night before we do a complete cleaning, we do 4 cleanings a day. In fact, that everything is set up to receive our families. So we start early. It's a tight schedule. It's a well-oiled machine at this point to make sure that all our children get in here, that they're safe, and that we can start the process of caring for them and for them learning also.
So if you have a 5-minute window for every child coming into the classroom, how long does it take to check in? How many children do you have in a class at any time?
So it's a 45-minute window per class. So 40 minutes for check-in and a 5-minute give or take on in case there's some backup. I mean, some reason why some child or something causes us a little bit of a backup. And we also have signs where you can only walk in one direction around the building and in the building so that people are not crossing each other. So we're really trying to practice social distancing, which is a complicated concept when it comes to child care. And we're trying to ensure that really we're keeping everyone safe.
And everyone in the facility is wearing a mask?
Everyone, the whole time you're in here.
So contrast the 45, 50 minutes to get all the children in to what it was before COVID. How long did it take, and what does that 50 minutes do to your day and the activities you conduct?
Before, it was much more fluid. Parents could come from a certain time, from basically 7:30 to 9, and then drop off their child anytime that was convenient for them. Now we just can't. We have to make sure that every classroom remains in its own pod. Heaven forbid we have a COVID case. We have to be able to do contact tracing. So we just don't have the latitude for parents or staff to kind of be flexible. We have to be very stringent in our policies and our procedures to make sure that everyone's safe. So it's a very different feel. Parents used to come in through the front door. It used to be everyone like welcoming them. Now they're coming to a classroom door. So it feels different. We don't get to see all the children come in the morning, some happy, some crying, some still waking up. We don't get to see all of that. So that's a very different feel. It feeds the energy of the center. So, and then we can't really go into classrooms if you're not the teacher assigned to that classroom, because we do not let any type of possibility of cross-contamination. So it's just a different feel right now. And one, we hope we won't have to continue any longer than is absolutely necessary.
So Robert Malone asked a question, have you had to deal with a situation where someone has tested positive and you had to close the school or close the classroom or change things because of that?
No, we have not we've not had a positive test of a child or a staff on facility, on at Bright Beginnings. While we were closed, we did have staff members who tested positive, and we were very concerned about that. We were able to work through that, but since we come back, everyone has been negative, and we haven't had any cases. And please let us not have any. Please.
Yes, yes. So when they come in, you do a temperature check. How do they get tested? How do you know the results of the tests?
Yeah, so we brought, so we don't do a COVID test. We debate, we let our teachers, because our teachers are the ones taking the biggest risk here. And so when you come in, there's a thermometer, it's the infrared thermometer. The teachers take the temperature of the student. We take temperatures 3 times a day to make sure that no temperature develops over the day. And we do a series of questions to the families to make sure that there's no evidence of symptoms. We do the same thing with our staff. They come in through the front desk, they're tested, they have their temperatures taken, and we ask them a series of questions. But we're really allowing the teachers to decide how often as a group and staff we're going to get tested, because even though you can get tested today and 5 minutes later come in contact with COVID, there's something to psychological safety that we want to provide to our teachers. So if they feel that we want to do it more than just the initial time that we'll do it, because they're the ones on the front line. They're the ones making the sacrifice. They're the ones coming into contact with our children. And so I have said very clearly to the staff that they're going to be the ones to dictate how often we get tested. If they need to feel comfortable, we're going to do everything we can to ensure that.
And the challenge now is if you get tested, who knows when you get your results? I got tested last Tuesday, still waiting to get any kind of result back. And I hope it comes today, but who knows? It could be quite some time, which means the test was worthless, basically.
It was. I totally understand. And that's one of the reasons why we haven't gone into a interval of testing, because the time is just too expanded for it to make sense at this time. But every week, Friday, we send out a summary report to the entire staff about the cleaning that we did and all the precautions we took. Again, our goal is to ensure that our staff and our parents know that Bright Beginnings is doing everything that they can to ensure that everyone is safe.
So do you give rules or guidance to your staff as to what they can do when they're off campus and who they can meet with and how that works? The worry is that they might get it and bring it in, or the parents. You give advice or guidance to the families about what to do.
We give lots of guidance. We do not have rules. What we have found is, and you probably know this, if you make a rule, people often want to break a rule. So we just ask everyone to be a partner in this effort, and we give lots of guidance. So before we came online, we spent a week of virtual training with staff, and then we brought them back for another week so that we can implement all of our procedures. They could weigh in, they can make suggestions so that people would buy into this. But this is serious, and so I believe wholeheartedly that everyone is taking this seriously because the costs are just, and I don't mean in terms of dollars, I'm talking about the cost of health. It's just too much for anyone not to. So I'm confident in our staff that they're taking it seriously, and I'm confident in our parents. They have been extremely cooperative and have not given any pushback to the changes we have made. And we've made a lot of changes. We have a whole manual for, we have all kind of forms, all kinds of things. One of the things that we were really concerned about is that children during this time did not get to do their well baby visits, were not caught up on their vaccinations. And so we had to make sure that that was the case and work with partners to ensure, because we are trying to control for COVID, but we didn't want to have some other communicable disease or breakout in the center because children had missed those vaccination deadlines.
And what's the dismissal like when the students leave at the end of the children leave at the end of the day? What's that like? Is it 5-minute windows again, or how do you handle that?
Yes, so you're assigned a time to come pick up your child, and you pick up your child. We're very fortunate. We built a new building in 2018. We have 2 centers. One is for infant and toddlers. The other is around the corner for pre-K. And we have a lot of doors that we can use. Some places are trying to send everyone through a few doors. So it helps with our procedures that we can ensure limited contact between people. So the morning looks like the afternoon. You have your time to pick up your child, and we really need parents to adhere to that and let us know if that's going to be a problem so that we can address it, because we don't have after care or evening care, because we can't combine classrooms at this point. We can't bring children together. We have to keep them in a pod.
So what happens if a parent's late? What do you do?
Our teachers stay with them until the parent arrives. But we really, I cannot emphasize how everyone has joined in this effort in remarkable ways, and understand that our teachers have put so much on the line, and parents are appreciative of that. And so they are getting here on time. They're trying to adhere to what we need to make all of this work. And we're so blessed and fortunate to have the parents that we have.
That whole sense of cooperation and looking out for others looks like you've got that going very well with your program. We could use a lot more of that across the country, I think. And people thinking of others as opposed to thinking of themselves. But that's an important, if we're going to get through this, we've got to do that. We've got to look out for each other. We've got to help each other. We have to, other people are relying on us to do our part so that they can do their part.
Absolutely.
We have a question from Nia Philpott, who's asking, she'd like to understand how teachers are expected to maintain a class both virtually and physically. Have you increased your staffing because of that?
So we, because all of our children are not back, the classrooms that are brick and mortar, the teachers are operating, are in the classroom, but all our staff is back. And so the virtual classrooms are happening with the teachers who don't yet have children in their classrooms. We did not expect for our teachers to be able to do both. So in this time, we have like a 4-phase reopening plan. And right now we're in phase 2, maybe move into phase 3. We're able to have some teachers assigned to virtual classrooms and some teachers assigned to brick and mortar classrooms. And so for right now, that's what's working. And we'll continue to monitor that over time as more and more families bring their children back. But we felt a sense of urgency to come back online, because for the parents who have full-time jobs immediately, they are often essential workers. They were in danger of losing their jobs. Remember, we're talking about the most vulnerable families already. We're talking about families experiencing homelessness with home instability, and losing a job will set them back even farther than some of us who've been a little bit more able to have a savings. So we've tried to think through this. We had to think through our teachers. Where would their children go? And so we actually figured out a way to support them with their children if they could not find support from somewhere for childcare. So we've had to think through many aspects of this to make it work. And so it's been great to see the innovative ideals and what people have been able to do to pull this off.
So what's your vision for the future? What if we don't get a vaccine until next year? What if we can't all come back together for several months, at least, another half year or more? And what if we lose those 6,000 plus slots you're talking about for childcare in the city? What does that do to our economy? What does it do to the region?
I mean, totally. Um, if we don't support childcare, it will tank our economy. It will not allow, it will devastate communities. It will increase the wealth gap that is very present in the DMV area. It will devastate communities like the ones we serve, and in particular those east of the river. It's just not an option for us to consider. And I think as a country and as a community, we owe our citizens much more than saying, what if it doesn't happen? We have to figure out a way for it to happen. We have to figure out a way to support the most vulnerable families. We have to figure out a way to pull through this. We've had some missteps. We have to put that behind us. We have to figure out how to go forward. We have to be bold. We have to be brave. We have to do what is right. I mean, this whole moment, in so many ways, is about saying to us as a collective group of citizens, as Americans, that we must do what is right. And so that's what we have to talk about. We can't talk about not doing what is necessary. We have to figure out how to get it done.
So Rachel Joseph has a question about how do we rebound from the situation in a more equitable way?
Well, I think the way that we rebound in a more equitable way is ensuring that organizations and families that we serve will have access to resources to serve these families. I think we have to have not only supporting organizations like ours, but the federal government, the local government has to figure out ways to continue to provide financial support in the next fiscal year, in the next budget year. There's no way. I mean, in 2008, it was devastating, but this is devastating times 10. We just haven't even began to feel the full impact of what it could look like if some of the programs are not refunded at the federal level. So we just have to talk to the people that represent us and tell them that we're just not willing to live in a country that will leave whole segments of the population behind, that we will be our brothers and sisters keepers, and that we will make sure that they are taken care of, and that we will think about things differently so that so many of the population is experiencing such a struggle from day to day. That's no longer acceptable. We have to do this differently. And so it takes organizations, nonprofit, corporate, government, all of us. We talk about here at Bright Beginnings having a 2-generation approach, working with both parent and child to put the family on a different trajectory. And we say it takes a village. It takes everyone, policymakers, corporate leaders, community citizens, all of us, educators, to pull this off. And we have to be pulling in one direction. We can't be divided and afraid it won't bode well for the country at all.
So we've got a couple of questions, comments from Brooke Kidd and Shane McLaughlin, basically asking sort of the same thing. We talked earlier about your $55,000 in more expenses just in the short term, and then you said it'll be about $250,000 for a full fiscal year. So who has stepped up to assist you to help cover that gap, and who's the corporate community, who's helping you during these challenging times? Give us some good news, Marla. Give us some good news.
Oh my God, you put me on the spot. But Bain Foundation gave us right off the bat $100,000 to help purchase the devices so that we could go virtual and continue to support our families and provide internet services. Stewart Trust was another major partner that helped and stepped up to ensure our individual donations. We've seen study support in that area. My development director is probably trying to text me right now to make sure I don't forget anyone. I hate naming names. And then we are just really been fortunate. We immediately raised about $195,000 just around our COVID efforts to support us. But we're concerned. We're concerned that if this continues for another year, 18 months, that same tenacity, that same enthusiasm will be consistent. Because we're going to need it. Childcare is going to need it. Bright Beginnings is going to need it to pull this off over the next year, 18 months.
So any good news stories from a non-financial point of view? Anything that
Plenty.
stepped up and has impressed you or surprised you?
I mean, first of all, again, my staff. When I tell you they were here on distribution days, putting resources together, everything from cleaning products to food. They were delivering them to families wherever they may be. Some of our families couldn't get here during that time. You know, buses were scaled back. Metro was scaled back. They went out and delivered them. So my staff was tremendous in this effort and making sure. My team and my development team and my organizational learning team coming together to build a at-home learning platform. I mean, I don't know people, we're not a tech company, but the way we pulled that off and we're able to do circle time, do music with Bright Beginnings, do all kinds of learning so that our children can continue to progress was amazing. At Bright Beginnings, we've been really thinking over the last few years about how we have a lasting impact. And we developed something called the Self-Sufficiency Matrix, where we work with our families in 17 different areas, from family service, workforce development services, home visiting services, therapeutic services, trauma-informed care, health services, and so to really support our families. And then one of the things also is we are really trying to close some opportunity gaps at Bright Beginnings. We have something called LENA. What we know is children who come from vulnerable populations arrive to kindergarten exposed to between 15 to 30 million less words. So our children have a device on them, and we're monitoring the number of words they're being exposed to, so that in grade 3, when they go from learning to read to reading to learn, that they have the prior knowledge to make that transition. And we're about to produce a white paper on that because we've seen tremendous results, even with COVID cutting us off. And we're not, we didn't get to do the intervention as long as we wanted to. The results of that effort has been tremendous. And so we're excited. And then we're back online, both brick and mortar and and virtual. So the dual model and what it takes to pull that off. So my staff has been phenomenal, bar none. The hard work, they've been willing to do what it takes. And so now we got a new slogan, excellence or excuses, but you have to choose one.
So Maria Rodriguez has a question of, what are some things employers can do to help their employees with small children?
Think about how if you're going to bring them back to the workplace, how you're supporting where their children will go. If you're not going to bring them back and you're going to continue to work from home, how they're going to be able to support the virtual learning of their children during this time. K-12 education is trying to figure this out. A lot of school systems have already announced that they will be virtual, at least initially. Parents are stressed out. I am a long-term educator. I taught for many years. I think people realize how difficult teaching is now. So corporations and organizations, employers have to figure out how to support their families while they're trying to be good employees, as well as ensuring that their children are going to have a future, and that they continue to learn.
And Robert Malone has another question for you. How do you measure success? You must have had a way, I know you had a way to do it pre-COVID. Has that changed at all now, post-COVID? And what do you think is going to happen in terms of that over the next couple of years?
Yeah, I mean, our formal way is our self-sufficiency matrix, as we help move families from crisis to vulnerable to stable to self-sufficient. But in this moment, it's about agility and innovation. How well can you adapt to a wicked problem, and how innovative can you be? That's the way we're measuring success. It's a time that we've never seen before. And so you have to be agile, you have to be innovative, and that's the way I'm measuring it now.
You know, it's great you say that, because that's something that we're hearing more and more from on the people that we do these frontline conversations with, that you've got to be innovative, you got to be flexible, you got to be agile, you got to be open to change, open to new ideas, because we're doing things very differently than we've had done before. And those who are going to succeed in this new environment are those who have been the most innovative and been the most agile. So it's very nice for you to say that. I couldn't agree with you more on that one. Any leadership other than be innovative, be agile? Any leadership lesson you've learned over the last few months that you'd share?
Oh gosh, many. The one that I've learned is that you have to have all the answers. We used to say that as leaders, we don't have to have all the answers, but secretly, we felt we did. These are unprecedented times, and if you have all the answers as a leader, you're just not respecting the gravity of this moment. So you just don't have to have all the answers. Pull your team in, have them try and help figure this out. It's the only way we're going to get through this together.
And we've heard that from several of, now that we're working from remote locations, it's more important than ever to sort of listen to others. Again, not to think you've got all the answers, but to listen to your staff much more closely than perhaps you did when you were there in person with them, as a way to gauge how they're doing and how things are going. So Marla, any LGW members that you've reached out to have reached out to you in the past 4 months?
Okay, so my team.
Okay, I like that.
Yes. I'm telling you, the Blue Mind Trust, my group, we constantly text each other. We're talking. We're just supportive. We have something we call jazzercise. It's just our time to get away from the world and communicate and connect. So the Blue Mind Trust is phenomenal. Every one of them, every single one. I think I have the best mind trust ever. And then there's just people who have reached out outside of the Blue Mind Trust. I don't want to name names, but I'm gonna name a few. Kim, she just was incredibly generous, and I just thankful for the support she offered to my son, not just me, but my son. Lupe, we just had deeply personal conversations about serving in this role of nonprofit leader. And it just strengthened me, and I hope I strengthened her. Paola is just a cheerleader. Whenever she hears anything about Bright Beginnings, she is cheering us along the way. Her company, by happenstance, actually designed the inside of Bright Beginnings. You can see it's a beautiful place. It brightens your day. Peter, he's just helped so many of us have a voice in this moment in our class. And so that's just a few people. But I really want to give a shout out to everyone, because so many people have been so supportive. And it's just been phenomenal. It has sustained me as a leader.
And if we want to help you, help Bright Beginnings, what are some of the things we can do?
Well, if you want to help us, you can go to www.bbidc.org, go to donate, and you can see we have a wish list. You can donate money. We have all kinds of things that you can do, but that's the place to go to learn about us and to contribute. We appreciate you thinking about us. We hope you will support us. Our families, our children need you. And we're just trying to figure out how to be brighter together and through all of this.
Marla, thank you so much for this conversation. Thank you for everything you're doing to help make this a better region and to help us get through the COVID. I'll ask you for any final word, but I forgot to ask, and I do want to get this, your perspective on all the righteous unrest that we're seeing now. Any thoughts that you'd like to share with us as a final word?
Yeah, you know, I say all the time that I'm just a little Black girl from Detroit, and I grew up in a family that's been committed to social justice issues. I am proud of our young people. They're holding us to account, and I support them wholeheartedly. This is, again, a moment, COVID, the righteous unrest, all of it, that if we have to recognize that we have to do things differently, every one of us, it's imperative if we're going to get through this and get to a better tomorrow.
Marla, thank you. That's a great way to end this conversation. So thank you for everything, and we will talk to you soon. Thank you.
Thank you, Doug.